Well, some good news on the health front. A new study showing promising results in the fight against Alzheimer's. It's an eye test that may be able to detect the disease decades before its onset. How does it work? With me now, neuro-ophthalmologist. We have a neuro-ophthalmologist on the show, Dr. Sreedhar Potarazu. Then I couldn't say your name. Sorry, Sreedhar. Thanks for coming back. Tell us about this test. It's a very important development.
It's a very important development, and the fact that they can, in fact, inject and give the patients this pigment that will be absorbed by the proteins, and in the number of people that they looked at it to correlate with the deposits in the retina versus those that also had these deposits within the brain was very high. Now, although the study is yet not complete, it's very promising, Jerry, to show that there perhaps is a means of doing a non-invasive study to look at those that are at risk for developing complications from Alzheimer's. So it's very promising.
So it looks like we're going to be able to detect the disease. And from the study I saw, the information on it, it was like 100% accuracy in telling you have the disease early on. But how is that going to help people manage the disease, get rid of the disease, not lose their memories?
Yeah, well, here's why it's relevant, because in addition to this new study, there's other evidence to suggest that by intervening earlier with patients with Alzheimer's in modifying either exercise, diet, or some other behavioral changes, that they can delay some of the cognitive decline that happens in Alzheimer patients. And so there is a big push now from a research perspective to try and look for other areas in terms of suggestions or earlier diagnosis so that by intervening they can extend sort of the functional period for some of these patients. And that really is where a lot of the focus is from a scientific perspective.
So are you telling me that Alzheimer's is associated with lack of activity, isolation? I've heard there's connections to depression. So if you're doing all the things right physically to be healthy, that might help you waylay Alzheimer's?
There's a suggestion that those things can be called sort of confounding factors in terms of accelerating the development of the disease. And so there has been a lot of research of late focusing on the impact of physical activity as well as certain aspects of diet. And so it's very interesting, especially in this study. We don't often look at the retina or the optic nerve as an extension of the brain, but in fact they are. And so it's very interesting to see that a lot of the changes that we're used to seeing in the brain further on in the disease that we can actually now correlate by simply looking at the retina. And if we can identify these patients earlier, perhaps there are some modifications that can happen to improve the quality of life. If you look between now and 2050, the number of people that are projected to be suffering from Alzheimer's is, going to be close to 13 million, which is, a big number. And so if there are things that we can do to ameliorate the number of complications and the number of people suffering from that, we're going to see a lot of research going in that direction.
It will help research if you can identify people early because you can study them earlier. Before you go, I'm just going to mention one more positive fact out there. The Alzheimer's rate in this country is actually falling. So that is good news for folks out there tonight. 44% lower chance of developing dementia than 30 years ago. Dr. P, thanks for coming on. Very good to see you.